Yes, Elsa, I hope you can hear me. But hi, everyone. Welcome to Maddie's Fun's Community Conversations. We're so happy you can join us today. I'm your host for this call, Sheila Kukan, and I'm joined with a fellow host, Elsa Ramos. Elsa is the bilingual adoption coordinator for Oakland Animal Services and will be my host for the remainder of August. So, really excited to have Elsa here. And Elsa has a background in individual and family services, now with a focus on animal welfare. And with a BA from UC Santa Cruz, she brings over a decade of experience in nonprofit work, including program development, volunteer coordination, and community engagement. Elsa is passionate about making animal services more inclusive and accessible for all. And I am just so grateful, Elsa, that you're able to join us and bring your time, your energy, and your brilliance to this conversation. So if you can hear me, Elsa, I would love to know, with all of your community-centric programming experience, what does community mean to you? She here?
Everyone. Can you hear
Hi.
me okay now?
Yes.
Okay, great. Sorry about that. Thanks for introducing me. So for me, especially in this work, community means connecting with people or connection in general, people coming together to support one another and getting these animals to loving homes. Um, and making sure that everyone feels included in whatever animal spaces that we hold and host, sharing resources with each other. And I tend to find that in places like these, like Maddie's Fun and Health for All, and different spaces where people are trying to bring animal welfare along with human welfare together. So I'm really grateful to be here and happy to be a co-host today. And I have a question of the day for everyone who's participating. So the question that we have today for you guys is, and you can enter your answers in the chat, what trust building approaches have you implemented that have enabled you and your community to build mutual trust together? So we'll give you guys a few seconds to respond in the chat, and I would love to see what you have to say about it. Again, it's what trust building approaches have you implemented and have enabled you and your community to build mutual.
And as people are answering, Elsa, I'm curious, do you think your role and having such an emphasis on bilingual adoption coordination contributes to trust in your community?
Yes, absolutely. I mean, when I first started, I was one of the only staff who spoke Spanish, so we didn't have consistent Spanish speakers during adoption hours. And what people have told me is that they notice a difference in people's demeanor and just a feeling of relaxation, not having to be on edge once they know that there's someone who they can speak to in their native language. And that over time is building trust because people are having a positive experience in their own native language and they're telling their communities about adoptions here and how they're pretty accessible and straightforward. And before that, if you're a Spanish speaker, for example, you'd have to bring either your child to translate or a friend to maybe help translate. And it's just a few extra hurdles that can really make or break an adoption decision. And I see a lot of people in the chat have been putting like consistency, listening to others, transparency. And I definitely agree. All of these things are really great for trust building.
I love it. Everyone,
Being
thank you so.
honest and consistent. Yeah.
We can keep it going in the chat. I think these are great. And I also love what you said about connection, Elsa, because I think that's really what we're hoping to create with these community conversations. And it's such an important part. So, for everyone, just a little housekeeping note, if you would like to join me as a future co-host and connect that way, or just share kind of what speakers you like to hear from or topics, please drop them in Maddie's Pet Forum. We have a little suggestions box there. So, really hearing from you all and connecting that way helps build this community. So thank you for mentioning that, Elsa. And really quickly, we had a grant giveaway winner last week from June who was not able to join us. So I'm going to introduce Kristen Streeter from Leah's Hope. Kristen, if you want to share a little bit about your organization with us.
Sure. Thank you so much for the opportunity. Much appreciated. Yeah, we were a grant recipient. So grateful for that. It was actually perfect timing. We are a foster-based rescue located in Decatur, Illinois. Those of you that are familiar with Illinois, we're pretty much flat in the middle of the state, kind of the central, a little bit east central by the Champaign area where the university is. I joined the rescue board probably about 6 months ago. My husband and I are coming up on year 3 of being fosters as well for the organization. So that's kind of what my level of involvement is. We kind of started reevaluating our fundraising, whether it was internal within our communities on Facebook, whatever that looked like, just to help keep the funds rolling in for the running expenses of the rescue, but also for those medical emergencies, of which we've had 4 in a course of probably about 2 months. 2 were dogs that came into rescue heartworm positive. But I'm glad to say they're both doing really well. And they're ready to start phase 1 and phase 2 of their treatments. Both, even better news, have adoptions pending once they've completed their placement. So super awesome there. We also have a location in Troy, Missouri. We have a foster network down there through the rescue. And one of the dogs that was coming in from a breeder release for that area had a heart condition, and I apologize, I didn't write down what it was. But there were 2 Pomeranians that came in. They both needed emergency surgery. And then were expected to live normal, healthy, great lives. So they were seen at the University of Missouri Vet Clinic. Both are thriving, both have been adopted, and they were really young. So super grateful for the medical care they got. And then our last one is actually one of my fosters. She is a mini Bernedoodle. She came in, pretty broken, and oh my gosh, I don't know what people are or, what everything is that's happening. So she was showing a lot of anxiety. And before she started her full medication regimen, she would eat any and everything in sight. So as we know, that leads to emergency exploratory surgery because things aren't working because there's something blocking. So yeah, got hit with some big medical expenses there. So this money was really well timed, and we definitely appreciate it. I guess if anybody has any questions for me, I'm happy to respond to those, but just wanted to, again, share a little bit about our group and certainly say thank you for the grant opportunities. Much appreciated, and we're very, very grateful.
Thank you so much, Kristen. Okay, so now we're going to move on to our national updates. So if anyone has any national updates, please drop them in the chat now. And you're also encouraged and welcome to share them on the discussion thread in Maddie's platform. That link will be dropped in the chat in a second. So you can always go to the forum and check out other people's national updates on there as well. Okay, so today we are joined by Claudia Vasquez, who is the Director of Community Engagement for Arizona Animal Welfare League. Claudia is the Director of Community Engagement, where she leads innovative strategies to increase access to veterinary care in historically underserved communities. And with over 2 decades of experience in nonprofit leadership, Claudia specializes in building culturally responsive programs, developing strategic partnerships, and fostering community-led solutions. Claudia is deeply committed to transforming systems to ensure pets and their people receive compassionate, accessible care. Please join me in welcoming Claudia for her presentation.
Thank you, Elsa. Hi, everyone. Thank you so much for joining us today, and a big thank you to Maddie's Fund for making this conversation possible and for the invitation in having me here today. Great. Next slide, please. I'm excited to share the work we've been doing at the Arizona Animal Welfare League. We are Arizona's oldest and largest no-kill shelter, and to explore how cultural responsiveness and co-creation can transform access to veterinary care in underserved communities. As Elsa mentioned, my name is Claudia Vasquez. I am the Director of Community Engagement at our organization. I will be talking about our journey, what we've learned from our community, and where we're headed next. Our vision is simple: a no-kill Arizona that provides compassionate care for animals and the people who love them. Today, I want to share how we've been working alongside our community to better understand their needs, build trust, and co-create services that truly make an impact. Next slide. In 2022, we partnered with PetSmart Charities to conduct the first ever bilingual needs assessment. We surveyed residents in 4 specific zip codes surrounding our shelter location, with the goal of gaining a deep understanding of the needs of these neighborhoods and exploring how we could begin to reshape the services we offer to better meet their needs and meet them. Every year, about 40,000 animals enter Phoenix area shelters. And at AAWL, at Arizona Animal Welfare League, we've seen more and more pet owners surrender their animals simply because they can't access or afford veterinary care. Through this needs assessment, we connected with nearly 600 Latin pet owners in Central City, Phoenix. Almost all shared that their pets were part of their family, yet many also expressed that they struggle to meet even their own basic needs, making it nearly impossible to pay for pet food or let alone veterinary care. The assessment allowed us to hear directly from the community about their challenges, their preferences, and the barriers they face in accessing pet health services. The information became the foundation for rethinking how we approach our work. When we asked about the community's biggest needs, preventative care rose to the top. Things like vaccines, flea, tick, and heartworm prevention, and spay-neuter surgeries. Pet owners also told us they wanted more pet care information in their own language. Many shared that they preferred services, in this particular case, in Spanish, yet didn't know where to go find them. The barriers were significant. 43% cited transportation as a major obstacle, and 60% said veterinary services simply weren't accessible to them at all. Many told us that they see their pets as family, but can barely cover their own basic needs, let alone pay for pet food or preventative care. This leaves them facing a heartbreaking reality, as I'm sure many of the communities that you all work with struggle with. So when illness strikes or any emergency that they may have, they may have no choice but to surrender a beloved pet. Our ultimate goal is to change that by offering affordable, accessible veterinary care so pets stay healthy, stay home, and stay with their families who love them. Next slide. So one thing became clear very quickly, that trust was essential for us. In underserved communities, there's often a history of organizations promising help, then not showing up or disappearing after a short amount of time. That leaves for a long-lasting skepticism. We knew we couldn't just show up once, run a program, and call it success. We needed to be consistent, present, and willing to listen before acting. That meant for us slowing down, meeting people where they were, and being open to co-creating solutions together. These survey results gave us the numbers, but we knew numbers alone weren't enough for us. We wanted to truly understand the people behind those statistics. So we began going out into the neighborhoods and getting to meet the residents. We met pet owners. We learned about their stories. We saw where they lived and heard firsthand who they trusted and who the real voices of the community were. We didn't just want to know what they needed. We wanted to understand why those needs existed and how they experienced them day to day. One of the first things that we realized as an organization was that relationship building is a hard skill. It's not meant for everybody. And maybe there's a lot of people that struggle with it. In our case, we had staff going into communities that really struggled with how relationship building was showing up. In the particular communities that we were working with that were predominantly Latino communities, once they get to know you and once they begin to build that trust, they start to embrace you and want to bring you into their home, to the point where they're rallying, bringing together the neighbors and the neighborhood block to come and listen about the resources that we're offering, what we were trying to do. And that felt uncomfortable for some of the staff that were out there doing the outreach. So we had to either hire staff that can embrace that or begin to teach them what that relationship building skill was about, and have them be open to learning that particular skill and how to do it. When we had focus groups in the community, it definitely shed light for us on bigger societal problems. So for example, in these focus groups, we learned that there were a lack of sidewalks in neighborhoods and there were no safe walking routes, which impacts safety for pet owners. They didn't feel comfortable walking their pets outside. So that was an issue. There was few or no access to public green spaces or recreational areas, which meant that they weren't able to take their pets out to socialize. And there was also poor lighting in some of the neighborhoods at night, so safety was a big concern for them as well. One of the things that we also learned was that relationship building takes time. It doesn't happen in 2 weeks. It doesn't happen in a month. It took us nearly a full year to really cultivate new partnerships and secure meetings, which what we call promotoras, which were the voices of the community, where promotoras were people that the residents would go to when they were needing to access resources or services for whatever they needed in their home. They also, what we learned was they're humbled by a willingness to give back. Just knowing that we were there to learn and hear their needs and their challenges and barriers, and we were at the table to try to figure it out together, how we can create programs, what they needed, how we can begin to even serve them. They were so thankful. Despite the language and cultural barriers, we shared the same love for pets, and that united us. And many, many times they've asked, how can we help your organization? Can we come and volunteer for you? Can we come and cook for you? There was always this willingness to help us out. Next slide. From all of this trust building work came a big idea, which we call our promotora model. Promotoras are volunteers or community health workers that are trusted by members of the community who share information, answer questions, and connect people to resources. Linda, shown on the right side of the screen, and Eloisa, pictured with her dog, were two of the very first promotoras we met. They played a key role in helping us build trust and get connected within the community. Whenever we needed to share important information or distribute resources, they were instrumental in bringing neighbors together and ensuring the word reached those who needed it most. We realized that if we could train promotoras in pet care information, we could reach more pet owners in ways that were both culturally responsive and community-led. We went back into the community to host more focus groups, asking residents directly what information and services they wanted to see for their pets. And the results were powerful. The residents themselves essentially created the framework for the curriculum that we are now designing. They told us what mattered most, and we used their input to shape a specialized curriculum that promotoras could teach, covering both available resources and essential pet care knowledge to the community. From those focus groups, we also signed up residents who were interested in piloting the curriculum when we are done with it to come back to them and make sure that all the information that they provided was still accurate and current with the needs of the community. And to take this even further, we are partnering with a nonprofit that certifies healthcare workers, so those interested can specialize in pet care, and this particular nonprofit serves the communities that we are currently working with. So this ensures that the work is sustainable for us, we're rooted in the community, and led by the people who are already trusted by their neighbors. Next slide. Alongside education, which we knew already was a high need for the community, we knew we also had to bring actual services into these neighborhoods consistently. We kept hearing it time and time again, not only by the surveys that we did from the needs and assets assessment, but also from the focus groups and conversations that we were already having. They needed somebody there consistently that they knew they could turn to, they can go to, and they knew exactly where to go. And more importantly, that it was available in the language that they speak. So from all those focus groups and from all the surveys, we now host monthly community clinics where we go into the community and we provide vaccines and microchips at low or no cost. We've partnered with a local school that hosts us and generally houses us once a month so that people know exactly when and where they can find us. This regular presence means people don't have to wonder if help will be there next time. They can count on it. And we are seeing them come back for their pets, boosters, or bringing additional pets for vaccines. Time and time again, we have heard when we were in the community about the struggle of hearing other organizations saying they would come in and they might come in for 2 months and then they would go out. Or they would come around some areas, but the struggle was always a barrier to transportation. So we knew that having a presence in the community, being there consistently, was a huge piece to the success of this work. Next slide. One of the tools that really guided our approach in this project is called the spectrum of community engagement to ownership. It's a framework that helps organizations think about how they work with communities, moving away from simply doing things for a community and instead working with them, and ultimately building toward community-led ownership of solutions. And that's exactly the spectrum we wanted to go to. By the end of this curriculum and those services, this community owns this particular service that we've created with them. They were essential to providing the feedback. They knew exactly what they needed. They voiced their opinions. So that was big for us. On the lower end of the spectrum, engagement can look like simply informing or consulting with the community. Essentially saying, here's what we're doing, or what do you think of this idea? That's where many organizations stop. But the more you move along the spectrum, the more the community becomes actively involved in decision-making, shaping priorities, and even leading the work themselves. For us, this meant not just gathering data and going back to design programs in isolation. Instead, we invited residents into the process from the beginning. We listened to their stories, understood their barriers, and asked them to help design solutions. This is how the promotora model was born. It wasn't our idea alone. It was shaped by the people who know their community best. What this offers is real sustainability. When solutions are co-created and owned by the community, they're more likely to last because they're grounded in trust, relevance, and local leadership. And for us, it was a way to ensure we're not just providing a service temporarily. We're helping build capacity within the community so that knowledge, resources, and leadership stay right where they belong. Not only was this focused in the community, but it also made us take a step back as an organization to reflect what kind of changes we also had to do in-house. We needed to hire more staff that represented the community. that could be culturally responsive, that understood the culture, that spoke the language. And we didn't have that. So we had to transition, hire more staff, hire more bilingual staff, hire staff from the communities that we were reaching out to. And this was another big shift for us. Next slide. So we're wrapping up the Promotora curriculum now, and soon we'll be launching with trained community members sharing pet care resources throughout their neighborhoods. We'll keep offering the monthly clinics, expanding our partnerships, and more importantly, listening to the community to guide what we do next. This is ongoing work for us, and the goal for us is simple: to make sure pets and their people have access to the care and resources they deserve. Thank you, and I'm happy to answer any questions.
Thank you so much, Claudia, for that great presentation and for sharing that valuable information. I really resonated with a lot of what you said. I am from San Francisco, from the Mission District, which is immigrant, low-income Latina community. And through my own lived experience, the places that I went to was the places that I trusted, and that my family trusted, and that my community trusted. So trust and like having a reputation, a good reputation, is so important to reaching communities of color. And I really appreciate the work that you're doing. We're gonna have a few questions for you. If you have any questions, please drop them in the chat right now, and we'll bring some up in a moment.
Elsa, that really resonated because here, obviously in Arizona, it gets really hot, right? So our summers, we see some extreme heat here. But the communities that we are working with, it's not uncommon for them to have multiple pets, and half of the pets are indoors and half of the pet are outdoors. And so meeting them where they're at and providing the resources and information versus judgment, that was huge for us. What can we do if they're going to have pets outside? What can they do to accommodate those pets the best quality lifestyle outside of the home, with providing them the resources and information, so that they have that knowledge as well. So that was a big piece for us as well, just shifting to that being culturally responsive, a place of no judgment, meeting them where they're at, and coming from a place of understanding and listening.
Yeah, I agree. And someone also mentioned that in the chat, that trust is so important, especially right now with all the political and social unrest in our communities. And I'm sure people have been having conversations all over California and all over the country about how people are afraid of, especially government facilities. Yeah, so it's especially important to bring in that element of trust if it's not already there.
Yeah.
So we'll start with one question. This one might have been submitted maybe right before you started, but do you have any advice on seeking grant funding for community-focused programs? Someone says that they haven't had much luck in getting grants from human services focused funders.
Oh, we haven't had any from human services focused. However, it is because we're blending now that partnership with that particular nonprofit organization that certifies healthcare workers. Their executive director is very interested in seeking together funding for this, and seeing if we could tap into grants that are specific to human services, but this is almost like a wraparound service, right? So it's very blended.
And another question for you, Claudia, is how did you ensure that you at AAWL would be a consistent presence in the community in a world of 3 to 5 year strategic plans and shifting priorities?
So we also had to come up with a strategic plan. And so one of the things that with us in our organization was prior to us doing the needs assessment, we really realized that the people that were coming to our shelter weren't local. They didn't live within the zip codes that we did our surveys. They weren't 5 miles or even 10 miles away. These were residents that were coming from 20 miles away from us. And so nobody around our shelter area really knew the services that we offered. And that was a huge issue for us. We were in their backyards and they didn't know the services we offered. They didn't even know about us. They didn't know where the organization was. They might have passed it a million times. And so for us, we really wanted to shift that focus. We have other shelters that are about 2-mile radius around us. We didn't want to, duplicate any services. We really wanted to focus on the communities around us. And we knew that we had some assumptions that the communities around us were highly underserved communities, and they were also high in Latino communities, Latino, Black, and Indigenous communities. And so we really wanted to place a focus on those zip codes around the shelter to structure our strategic planning on the way those services would get developed. So that way we will continuously maintain a presence in these communities, and these communities will be our focus.
Okay, one more question. When you ask about needs to a community, you ask them about their needs. Sometimes people don't know what they need. Did you see any change in requests as they became more knowledgeable about better pet care and types of resources available?
Yeah, I think we started to see that shift when we were in focus groups, when we were really able to talk through, what the needs looked like. So obviously through the surveys, through paper, we knew vaccines and, a lot of the preventative stuff came out. But once we started to do focus groups, we really started to see that they needed basic pet care information. And this is where things like just even understanding what the difference between kibble, dry food, and wet food. What's the difference and which one do I feed? Where's, a good place for me to have my pet sleep? How do I introduce pets to my family members or to the other animals in my home? What leashes, what collars do I use? All these things were coming up in the focus groups. And this is what really guided us to create the curriculum together. And so the focus groups focused on that, was diving into more of where those questions lied for them.
Yeah. Okay, next question. Are there any reliable sources available to translate our forms and informational collateral in Spanish? Relying on AI can be scary for accuracy, and our limited bilingual staff doesn't always have the time to check.
Yeah, so we do utilize our bilingual staff who are able to translate, but for large amounts of work, which in this curriculum, it will be bilingual, we will have to source that out. And we've set aside some funding for that, for us to get it translated. And we know that it's a big struggle.
And then I'll also share a resource. I don't know if anyone has worked with Patitas y Palabras in California. If anyone's able to help me and drop a link if you know of them. But they are an organization of Latinx folks who have worked in animal welfare. So they're very versed in that language, spay neuter, microchipping, like how to translate very specific words into Spanish in a way that makes sense. So they're a free resource for any shelters. And I also put in the chat earlier, it's really important to hire bilingual staff. It's hard to just rely on AI, Google Translate. It just doesn't make sense if you're really trying to reach that community. So really investing in the folks that you're hiring. Okay, next question. Can you give us an example of how you periodically recognize partners in order to keep them engaged in the work of the shelter?
I'm sorry, can you repeat that? Oh, you're muted, Elsa, sorry.
Sorry. Okay. Can you give an example of how you periodically recognize partners in order to keep them engaged in the work of the shelter?
Yeah, so we have been, not just focus groups with community members, the actual residents that are living there. We've also engaged community partners with focus groups with their staff to learn about what they see and what the needs are. And so we periodically will do focus groups with our partners, as well as we have our access to vet care manager, who really is, she's been amazing at creating these partnerships in the community. And she consistently on a monthly basis will rotate dropping off, food or any kind of donations that we receive and are able to give back to the community. She will do community drop-offs in those areas. And so she's always consistent in making sure she has a presence, just even in participating in their outreach events, any events that they're having for their families that they serve. And so I feel like that two-way engagement is really important. We're just as engaged in being present with the services and any events they're doing. And they're just as engaged with providing us, space or hosting us or feedback on the needs of the community.
I also, yeah, definitely encourage the outreach piece, um, especially if there's just even health fairs, even job
Mhm.
fairs, school fairs. Those are really great places to get your foot in the door with different partners. And once you become more of a presence, then people will refer folks to you.
Yeah.
But if you're an organization that's not very well known, that's a great place to start.
Yeah, like I mentioned earlier in the presentation, it really took us a while. It didn't happen overnight. We were originally, the program it was just me originally going out to the community. And then we, hired our access to vet care manager. And she's been out there, really creating those partnerships. But it took over a year for us to get to the point where now people call us and are inviting us and sending us the information instead of us constantly knocking on the doors and saying, do you have any events? Can we be there? Do you need any pet food? So it's definitely come full circle.
Can I ask you both a question that is kind of putting you on the spot? But I know we both emphasize the importance on bilingual representation and translation that are like really kind of, I think in your community conversation, Elsa, you had mentioned it being like culturally responsible and culturally responsive. But when you mentioned that the translation services from Google aren't good, do you have any examples of some bad translations you've seen?
Yes. Well, I think in Spanish, at least, there's so many different ways based on person's like country of origin. Like for the same word, there can be like 10 different translations for it. So even when I do try to say, your pet, we encourage your pet to get spayed or neutered from whatever region they might be in, they still don't understand what that means. So it takes intentional time to come up with the most accessible way to bring this up. And I don't think that's something I've been able to find with Google Translate. When I just type it in, it gives me one response. And if that's the response we're giving, let's say to our English speaking volunteers to pass that on, it's just not going to get through. Um, and it's the same for all different parts of animal welfare, like indoor, outdoor, spay, neuter, vaccination, microchip, like, and even within the Spanish speaking community, there are lots of different, I'm sure in all communities, different misconceptions about shelter life and shelter animals and rescues. So there's a lot of things to tackle, even in all cultures, when it comes to shelters. So it's gonna take more than just a translated like booklet or pamphlet. We do have those that can help maybe level one Spanish speakers kind of get through a basic conversation. But like we said, if we're trying to build long-term trust and long-term relationships, um, they will know that that's not a place that they can go to if they have Spanish speaking folks. They're not going to recommend them to go there unless they can get their own translator, which is really, really difficult.
Yeah, I agree, Elsa. I think I was going to use the same example when you talk about spay neuter. I think that's probably one of the bigger ones. You know, in Spanish, the literal translation, which is castrado, is, you know, it's very harsh. A lot of people don't use it. They kind of steer away from that word, maybe use surgery in, you know, in Spanish or
I think in English, when you translate it back, it's castrate.
yeah, it's
So
castrate.
it's a strong word. And
Yeah,
then some people, and I think maybe I heard in Colombia, they say um, disconnect, right?
mhm.
That's the term that is used. So there's so many different ways to even just say spay neuter.
Yeah, so when you're doing the AI translation or Google translation, you know, you risk that, you know, error that the way it gets translated is not good. It's going to miss what you're trying to say, and it's just not going to sound correct. So we go through that a lot as well.
And we've partnered up with libraries, and they've also mentioned that, you know, when you promote an event, let's say the flyers in Spanish, you come into the event, you bring in Spanish speaking folks, but then the volunteers or the staff are not Spanish speaking, then the event is not for them. But in an effort to want to be inclusive and to want to outreach to as many people as possible, we can do that, and we can, you know, translate in Mandarin, Vietnamese. But if we don't have anyone on site who's going to actually help them, then we're doing them a disservice.
Mhm.
So we need to have some sort of actual relatable translation on site.
Yeah, for sure.
That was so helpful. Thank you for sharing. I think it adds to really know the context of like what bad is. And yes, I was in Colombia when they were mentioning disconnected and we were like, wait, what? So it's not just, I mean, like the cultural component is so important too. So I appreciate that. And I think
Yeah. And
we're, oh,
I'll
go ahead.
add the last comment that Nadia put in, which I think is really important, that putting out any messaging that doesn't make sense is not ideal in any language. So even if it's in English, you wouldn't want to put something out with grammatical errors or that's just not going to be clear or make sense. So we wouldn't want to do that in any other language. Thank
Yeah.
you for that, Nadia.
I also think like just using, you know, a simple language. A lot of the times we get used to in our world, right? In our work world, just like we get used to using acronyms, you know, our medical team, when we're doing community clinics, calls our checkout table, which has resources and information about the vaccines received, they call it discharge. And so even just using terms that are just a little bit more relatable in regular, you know, normal conversation language that people and the community would understand is really essential. And just looking at the terms that you use is important.
All right, thank you, Claudia. I think we've gone through the questions that were submitted in the chat. Um,
I see we have one question that
oh,
just came in. We want to do that really quickly and then we can head to a reflection question.
yeah, Emily shared, depending on staff to translate without training or compensation, it's unfair. I'm thinking of a time when our only Armenian speaking staff member was on the facilities team. Yeah, that's right. It's really, it's very valuable work that needs to be compensated fairly. Um, and it's hard to put that on your officers and your facilities team and your volunteers
Mhm.
without them really consenting to it. And some people do it because they're the only one and they care.
Yeah.
But it's really not fair to not compensate them fairly. And then the last question is, how are promotoras identified and connected with?
Yeah, that's a great question. So we were connected with promotoras just by being in the community and attending, you know, all the events. We were going to Zumba classes where they were distributing resources. We were going to the bingo night. We were going to, you know, the local faith-based churches in the community, just to really, you know, learn their needs and have them get to learn who we were. As we move forward with the promotora model, part of the partnership with the nonprofit organization, they're called Unlimited Potential. what will happen is when the curriculum is ready, we will do a train the trainer model to their promotoras, and the promotoras that are certified will, for those that are interested, would get to choose this pet care model as one of their specialties. So the promotoras already specialize in different health issues like diabetes or, certain cancers. So this would be in addition to that. This would be a specialized pet care curriculum that they get specifically trained on. So when they're in the community, they're able to do presentations or trainings or provide the resources to the families that they're working with.
Thank you, Claudia.
Thank
Please join me in thanking Claudia in the chat. Thank you so much for your presentation, and thank you to the audience for joining us today. Claudia is going to be available on Maddie's Pet Forum throughout the week to continue the discussion, answer more questions. So feel free to post more of the questions in the link that will be shared. And we're going to continue this conversation on the forum and here with a reflection question. Would love it if you all can share what is one thing you will bring back to your organization to improve access to veterinary care in your community. It'd be great to connect with each other around that. What is one thing you will bring back to your organization to improve access to veterinary care in your community? Would love to hear some responses in the chat or the forum.
Thank you so much, Claudia, for that beautiful presentation and sharing. I think I definitely have my